Carlos.
Thank you, Steve. Thank you for the answer. Can you hear me okay?
Yeah.
Stephen, I'd actually go back to a little ad I ran in a longevity magazine. I can't recall, it's now gone, and I remember the one from Vegas, Chen, used to advertise in that very heavily, especially bodybuilding magazines and that magazine. And I ran a little ad about something, whatever, and then Steve and I connected maybe more than 15 years ago. So, but then I think the whole issue, for me at least, is all about passion. Because I remember my first Life Extension magazine goes back when I had a meeting with Bill Falloon at A4M, actually. That was one of the explosive meetings of A4M back in like 1992 or 3, when A4M decided that we're not going to distribute Life Extension magazines to all the people attending that conference. And A4M actually started in 1991 in Cancun with Goldman and his colleagues. Anyway, there were about 5 people, whatever. So to me, it's an issue of passion. And then when you're passionate about something, you're going to do something well, and eventually people are going to hear about it, and you're going to get results. So again, agreeing with Dr. Miller, it's not about this certificate. There are many, many patients I have seen who have been to doctors that have that certificate. They have this whatever course they've attended, but when the patients start asking them questions, well, tell me about this and tell me about that, the answers are not really deep, and they're not well thought. They're just not there. The patient can smell, quotes, a phony or a person who doesn't have it. So patients are pretty smart these days, especially those who want to involve themselves with life extension, longevity, whatever they can to make themselves live longer, better. So to me, it's being passionate about the field, being in meetings like this. For me, I think an anti-aging doctor should be in the arena of PhDs. I mean, to understand what Aubrey de Grey speaks about. I mean, read his book and read all the stuff that you can. I mean, I read his book, and that book kind of, I knew some stuff, but he clarified a lot of material. Read Michael Rose's stuff, understand what Michael Rose says. I mean, if you can do that, then you've got your foot in 2 camps. You've got in the allopathic field, but you also got your field in all about evolutionary biology, biogerontology. You've got to know a lot of things to be a good doctor in this field. You've got to know nutrigenomics. You've got to understand what Jeff Bland does in terms of metagenics in his field, and a whole bunch of other people in functional medicine. So it's basically, I guess that's a long answer for, basically it's all about passion and interest and keeping involved but people will smell it, I think.
Dave, next.
Thank you. I consider age management, anti-aging, science of staying young, whatever you want to call it, a primary care specialty. And I mean that in multiple levels. I think that really, if I were, well, I shouldn't say if I were, I should say my primary care physician is an age management physician. I believe that you should have some grounding in the primary care aspect of patients. That doesn't mean you couldn't be a plastic surgeon or a cardiologist, but I do believe that people who take care of people on a daily basis understand their problems, understand the problems of their relatives, understand the problems that are associated with aging, and are responsible for the outcomes, not just one outcome like what you do when you put a catheter in a heart, but the overall outcome and health of that patient make the best anti-aging physicians. I couldn't agree with Carlos more as far as the absolute need to keep yourself educated, and to me that means, for better or worse, CMEs, some type of way of measuring your involvement in education. It's not the best meter, as Phil and I discussed last night. It's actually not a very good meter at all, but it's what we have now. And as the information technologies improve, we're going to be able to find out more about all of us. So that's the other thing. I also think it's absolutely critical to establish a rapport with the patient. If you can't do that, and I know a lot of fabulous doctors who can't do that, and they've been sued because they can't do that, not because of a lack of knowledge or a lack of a base, but you've got to be able to talk to people, and you've got to be able to talk to them at a level that they understand, which means translating everything that we've got here in this conference to everybody who doesn't understand it and making it available for them, and understanding what their budgets are, understanding what their social pressures are. So again, I consider it a primary care specialty, even though the primary care associations would tell me I'm out of my mind. So.
Joe.
Hi. I would agree, first of all, with all the previous panelists' recommendations in that there's a certain base level of knowledge that's required, but any specific academic or organizational certification is, in my view, almost irrelevant because it's really what you know. And that also was said that the public knows, that they are going to sense what's real, what's true, what's authentic. And this is the 21st century, and we have other technologies now that can help us assist us in this identification process. I started a website about 12 years ago, which has now grown to the most visited natural health website in the world. We have about 20 million views a month. We're the 10th most visited health site in the world overall. So we have some experience in this understanding. It's a common question that occurs is how do you find a physician locally? Because we have not yet set up a network to identify physicians. But what I tell people, first of all, is that your local community would be the best way to do that. So this is a little bit different because it's more of a subspecialty, but typically health food stores are a great collection of community knowledge, and the people who own those or work there are really good repository. So you wouldn't necessarily go to one, you'd go to a number. But then beyond that, and using the internet as a tool, there are sites that can collect this information and knowledge, and that there could be a consensus. And I'm not sure if everyone is familiar with how popular Facebook has become, but Facebook in July of this year had 250 million users in July of 2009. And as of September, literally 90 days later, they had 300 million users. It is the third most visited website in the world and will be as common as email is today. So that's there's a lot of Facebook groups, so to use that as a resource. Very powerful tool that can essentially allow us to leverage the collaborative wisdom of the community to identify these individuals.
Very good. Moving on to the second question, I would like Carlos to go through the list because
my list.
Yes, yeah, it's coming up. Yes, going back to So, the first sub-question here, it's based on the assumption that the consumer is really an intelligent consumer with a full range of time to answer questions and interview doctors, like on a 10-point scale, you said, to evaluate each of the doctors you're going to interview and take notes and decide then at the end of that time who might be the best physician for you. And so you made a list of 20 questions, the first of which says, tell me about the relation between telomeres and aging. And of course, that was one of the main topics yesterday. So if you were here in the audience, you know a heck of a lot about that. But ordinary physicians may know nothing about that. So that's a very selected subset of physicians who have a PhD level of knowledge about the molecular biology of the aging process. So, Carlos.
Well, I agree. This is a very technical questions for the sophisticated anti-aging shopper, should I say. So I do see in my practice unsophisticated, sophisticated. I say, what are the main complaints that people present with, where they want, quotes, anti-aging, the magic bullet, growth hormone releasing hormone, blah, 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 and so on and so forth, testosterone and so on and so forth. And there are people who simply, if I was, they would not know anything about telomeres. I mean, there are those people who, and they could care less, unless it was put on, national news that we now, of course, we have this with Dr. Dave here, the TA65, which I've been looking at his data on, which looks kind of interesting, very interesting, coming from Geron. But the average anti-aging consumers, I think this is going to be over their heads, some of this stuff. So these questions would be probably for only, like I said, a select group of people, but just as a, quotes, way to challenge them, if they don't know some of these basic terminology can answer it, I think you better move on. So if they have no concept of a telomere, then maybe you're in the wrong shop or with the wrong doctor. And what Dr. Dave was saying, there's also cost effect. There are places that will promise you, and I've got patients from Palm Harbor, Florida, and all kinds of places, and the doctors treating those folks were getting charged a huge amount of money, and what they were getting was just about it's like simple stuff with a big price tag, and I see that a lot all the time. And I educate these people. Listen, somebody's charging you for whatever hormone XYZ, and they're like triple charging you because they're selling out of their office and so on and so forth. And you can save a lot of money and still do. The simplest thing for anti-aging is eating less. I mean, you're saving money by less groceries, and you just eat well but eat less. I mean, first do that rather than go for the silver magic bullet. So. I agree this is a little too technical, but I think these are questions useful just to know, have they done their homework? If they haven't, well, maybe go move on.